Our next presenter is Dr. Sandra Garrido from the Marks Institute for Brain Behaviour and Development, and Sandra's topic is music and mood regulation in adolescents and older adults with depression. Thank you.
Depression affects more than 300 million people worldwide. 1 in 5 women and 1 in 8 men will be affected, and it can decrease their life expectancy by up to 25 years. There are 2 groups that are particularly affected by this. One is adolescents and the other is older adults over the age of 65. Those groups tend to have particularly low rates of mental health literacy, meaning that they often have less understanding of what they're experiencing and less access to effective strategies for managing their moods. Music has always been a really big part of my life, and I guess for a long time I've been fascinated with the powerful effect that music can have on our moods and emotions, and ultimately even our long-term well-being. But our research has shown that it doesn't always have a positive effect. It can sometimes have a negative effect on people. And in fact, people with depression are often most vulnerable to those negative effects. For example, most of us can listen to a sad piece of music and we get some positive psychological benefits from it. But for a person with depression, they might listen to the same music and it actually makes their condition worse. So my colleagues and myself are working on 2 important projects. In one, we're working closely along with young people to co-develop and design a web-based program and a mobile app that will use music and technology to help young people understand how their own behaviours can either contribute to or help alleviate their depression. Similarly, we're also working closely with aged care providers, with people who care for people with dementia, and with consumer advocacy groups for people with dementia to test a protocol that we've developed, or a set of written guidelines to help people who are caring for people with dementia understand better how to use music effectively to manage the moods and behavioural symptoms of people with dementia. We've had a lot of interest in our research, both from the media and from the general public. A book that I published earlier this year in hardcover version has already had more than 2,000 downloads in the ebook version. I was able to give a TEDx talk last year for TEDx Youth, which was viewed by hundreds of young people live at the Opera House, thousands more by live stream around the country, and has since been viewed by nearly 6,000 people on YouTube since then. In addition, I've had more than 25 media interviews in the last couple of years for television, radio, newspapers and other print and online media. And my media report for a 6-month period alone showed that that had the potential to reach an audience of over 900,000 people. So people are hearing about this research, it's getting some attention, and it's changing the way people are using music in their everyday life. It's raising people's consciousness of the potentially negative effects that music can sometimes have for people that are vulnerable to that, and of how music can be used effectively. It's also changing the way music is used in healthcare settings. In fact, I'm regularly invited to participate in training sessions for healthcare workers to help them understand how they can assess the risks of using music and how they can use music effectively for the people within their care. But I think that what really touches me the most is that after every wave of media interest, there's a wave of emails that I get from people personally, people in the community. They may write to thank us for the information. They write to share their own stories about music and depression. And they write to ask for help. You know, they may be somebody with a son with depression or a mother with dementia, and they want to know, how can I use music to improve our lives? So I think that it's this public response to the research that we're doing, which really demonstrates the potential for this information to have a big impact on people's health and well-being in daily life. And it personally strengthens my own determination to make sure that as many people as possible do get to hear about this research.
Excellent. Thank you very much, Sandra. A question?
Thank you so much. One of the things that I do is chair residential aged care. So I was very interested in what you were saying. Now, more than half the people we have various forms of dementia. It's clear that they prefer the food they had in the 1950s and 60s, the gardens they used to live in. They like bus stops with wooden seats. All these things we know are comforting and will revert to first language if it's not English. What is it with music? Would music, on the whole, for patients with dementia, they prefer the music that they used to know 40 years ago?
Yes, definitely. There's a period that we call the reminiscence bump, which tends to be the period from when they're in their late teens to sort of early 20s, and they seem to really recall the music that they were listening to in that period most clearly. But we're also looking at how the actual features of the music interacts with the person's physiology as well, you know, fast tempos and how that can increase their arousal levels. And so the guidelines that we've developed sort of combine the two, trying to account for people's individual preferences and the type of music that they like and what's relevant to them personally, but also looking at the effects that the actual features of the music itself can have on them depending on what their symptoms are.